Hi, I'm Gracie, and I will be helping you learn about your PEG tube while Sam demonstrates. This is a plastic tube that is put into your stomach through your skin. It is most often used to give you food or liquids if you cannot eat or drink. Medical formula, medicines, and water can be given through your PEG tube. There are different versions of PEG tubes, but they all look similar to this. With your PEG tube, you may see some drainage around the site, which is normal. It will be important to keep your skin clean and dry around the tube. Every day, you should look around your tube at your skin for redness, tenderness, swelling, drainage, or leakage. You can shower 24 hours after you have the tube placed, unless your doctor gives you other instructions. You should change the dressing at least once a day. Begin by gathering your supplies, including a package of 4x4 split gauze, antibacterial soap and water, and cotton tip applicators or Q-tips. Start by washing your hands before starting your dressing change, and then remove the old dressing. Once a day, and as needed, remove the drainage, crusts, or blood from the skin around the tube by using warm antibacterial soap and water. Clean in a spiral pattern, beginning at the tube and moving out. Once you're done cleaning, rinse with water and pat dry. Place the 4x4 split gauze around the tube site. If you would like, you can use tape to secure the gauze in place. Once you're all finished, wash your hands again. Next, we will show you how to use your PEG for a tube feeding. Gather your supplies, including a towel, syringe, cup, formula, and water. Sit upright in a chair and place the towel on your lap. Draw up 60 milliliters of warm or room temperature water into the syringe. For this video, we will be using just a small amount of water and formula. Attach the syringe to the end of the tube. Unclamp the tubing and slowly push the water in. Clamp the tube again and remove the syringe from the end cap. Open the formula container and pour it into a cup. Draw up 60 milliliters of the room temperature formula into the syringe. Again, for this video, we will be using just a small amount. Attach the syringe to the end of the tube. Unclamp the tube and slowly push in the tube feeding over about 5 to 10 minutes. If you push it in too fast, you may have reflux, nausea, or vomiting. Clamp the tube and remove the syringe. Repeat the process of drawing up 60 milliliters of formula in the syringe and pushing it into the end of the tube, not forgetting to clamp the tube in between until the feeding schedule is complete. Flush again with 60 milliliters of water to complete your tube feeding. If you're not doing feedings, you will still need to flush your tube with 60 milliliters of warm or room temperature water every day to keep it from getting clogged. If your tube is clogged, you can try the following. Flush the tube with 30 milliliters of warm water. Try to draw back with a 60 milliliter syringe. Gently rocking the syringe plunger back and forth may help clear the blockage. Repeat as needed, and it may help to change positions. To take medications through your tube, you will do the following. Flush the tube with 30 milliliters of warm water. Try to draw back with a 60 milliliter syringe. Gently rocking the syringe plunger back and forth may help clear the blockage. Repeat as needed, and it may help to change positions. To take medications through your tube, you will do the following. Start by flushing the tube with 30 milliliters of water. Every medication must be liquid or finely crushed and mixed with water. For the purpose of this video, our medication is already crushed and mixed. Please review your medications with a nurse or pharmacist to make sure that the medication can be crushed. Draw up the medication in a syringe and push it into the tube. Then flush with 30 milliliters of warm or room temperature water after each medication. Call your doctor for any of the following. If you have signs and symptoms of infection, which may include chills or a temperature over 100.4 degrees Fahrenheit. If you notice redness, swelling, increased pain, or foul-smelling drainage around the tube. If your tube is clogged and you cannot unclog it with flushes and position changes. If you have consistent or prolonged diarrhea, nausea, or dehydration. If you have choking or coughing while giving yourself the medications or feeding, or if you notice a change of 2 or more numbers on your PEG tube at the insertion site. If the tube falls out, contact your physician immediately and go to the ER.
On behalf of ThedaCare, we wanted to thank you for allowing us to be part of your healthcare journey.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.
Thank you.